Hello, everyone. I'm Ashley Davis, and my demonstration speech is how to make an occupied bed. Now, to start with, you need a fitted sheet, then you would need a drawer sheet, and then you would need a top sheet. So basically, making an occupied bed is something that helps you and the patient. Usually, when you're in the hospital or even at home with sick family members, it's kind of hard for them to get out of the bed due to low energy from being sick and also due to the fact that they're just tired. Certain medicines can have them woozy, can have them sleepy, so at times they just don't feel like moving. So what are you to do? Are you to just leave the sheets on the bed, allow them to sleep in their own feces or urine or throw up? No, you still have to change the bed. You still have to make sure that they're okay. You still have to make sure that they're comfortable. And you also have to make sure that they're still moving, basically. Sometimes people get sick and they lay in the bed for days. You have some people who stay in the bed for weeks. And when it comes to the hospital setting, you have some people who stay in the bed for months. So let's get started. Okay. Now, as you can see, I'm home alone. So I do have a patient. 1 second. So everyone say hello to Miss Tibia. This is my patient for today. And me and Miss Tibia are going to show you guys how to make a bed while someone is laying in it. Okay? So, Miss Tibia, I'm going to say her right side is her strong side, and her left side is her weakness, okay? We're going to put her directly in the middle of the bed, just like that. Now, usually when you come into a patient's room, there's already dirty linen on the bed, but we're not going to do the dirty linen part. We're just going to start with actually putting the clean sheets on the bed. So, which sheet do you think you would start with? Let's say we're going to start with the fitted sheet, being as though that's the one that goes on the bottom. Making an occupied bed is good for the patient for plenty of different reasons. I'm going to say the first main reason is to make sure that they're comfortable. Being comfortable and sick is like the most high of high situations. Like you're already sick. You're already feeling bad on the inside. Who wants to feel bad on the outside? Just like when you get out the shower, you want to make sure you're in fresh sheets. Once they finish getting their bed bath and things, they want to make sure they're in fresh sheets as well. So we're going to pretend that we just gave Miss Tibia a bed bath. And her sheets got wet, so we need to change them. Okay? Let's go. So, as I explained in my PowerPoint presentation, when making the occupied bed, you always want to start from the strong side for a couple different reasons. First reason is the patient can help you. The patient can help you hold themselves up. And on top of that, when it's time to work on the weak side, it's less to do. So you start by putting the fitted sheet on both ends of the bed. Also, when making an occupied bed, you never want to flap the sheet out. If you're at home, flap it all you want. But if you're in a hospital setting, you don't want to flap it because it basically blows germs around. So, you take the fitted sheet and you line it in the middle. Miss Tibia is still laying here. Mind you, I have no reason to ask her to move yet. Now that's the fitted sheet. Now this is what we call the drawer sheet. And the drawer sheet is basically if you have a patient who's incapable of sliding up or down the bed by themselves, the drawer sheet comes in handy. What you do is you fold it in half. So you make it about like a rectangle shape. I'll say about like this, rectangle shape. And what you do is you stuff it under between the mid of their back and a little bit under their bottom. Okay? So we're going to take our draw sheet and we're going to lay it directly in the middle to where Miss Tibia is, okay? Right now, as you can see, the sheets are touching her. That's totally fine. You bring it back and you just tuck, okay? So at this point, we know that we're on Miss Tibia's good side. So it's going to be easy to say, hey, Miss Tibia, can you hold on to the railing? Or do you mind grabbing onto the side of the bed so you can help me keep you situated? So once you ask the patient to do that, you just do as follows. Miss Tibia, do you mind grabbing the other side of the bed, please? So now she's taking her strong arm and she's going to roll over on her side. Now, with some patients, they can't do this much. So you have to actually sit and see if they're able to pull their body or if they're able to take their leg and cross it over the other one. Some can, some can't. And this is what's going to help you realize body mechanics. Body mechanics is something that you can spot, something that you can see as you're making an occupied bed, because body mechanics is a big deal when it comes to getting the patient back to a good stage. So let's move on to top sheet. And as Miss Tibia is rolled on her left side using her stronger side, we're going to take the fitted sheet and we're going to slightly tuck it under her. And then we're going to take the draw sheet and we're going to slightly tuck it under her. And once we get there, we're going to pull it on back. Hi, Miss Tibia. And as she's on her back, she's on a lump. This is a position that you don't want to keep your patient in too long. If you keep your patient on a lump, it can become very, very, very uncomfortable. So you want to make sure you do this swiftly. A swift motion, it'll definitely help. Now, mind you, right now, we're on the weak side. So once you get to the weak side, this is where you know body mechanics isn't going to be as strong as it was in the beginning. So you have to use a little bit of your own muscle. So I'm going to come to this side. Miss Tibia, I'm going to help you with a little push, but I need you to stay up on your right side. They usually say, okay. So now as you're holding the patient on their side, you're going to take the blanket and you're going to finish connecting it to the bed. Both sides, both ends, gently and swiftly, just like this. And then you pull the draw sheet over. And then you say, okay, Miss Tibia, you can roll back on your back. And now she's in a fully made bed, and she only turned twice. So as you can see, it's not too hard. It's actually pretty quick and simple. But you're not done until you place the top sheet. This is where the comfortable part comes in. Miss Tibia, are you okay? 9 times out of 10, they're going to say yes. And now you have an occupied made bed. Thank you for watching. Have a good one.